Zealand.
Question number 8, Honourable Annette King.
Thank you, Mr Speaker. My questions to the Minister of Health. Are all district health boards meeting his expectations of providing timely, quality health services? If not, which DHBs are failing to provide better, sooner, more convenient health care?
Honourable Tony Ryle.
Mr Speaker, generally yes, although there's always room for improvement. DHBs are receiving over $1 billion extra over the next 4 years, and they're doing a very good job in tight financial times. The last quarterly national health targets published this week show that New Zealanders are receiving even more checks for diabetes and heart disease, more help to quit smoking, and they're getting more elective operations faster. The government inherited a health service on track to ruin, but thanks to strong financial management across the sector, we're now able to invest more in the changing needs of our population.
Supplementary question,
He's a joker, isn't
the Honourable Annette King.
A supplementary question, Mr Speaker. Well, in light of that answer, the optics aren't good for you today, Stephen. In light of that answer, is it acceptable for a patient to wait 12 months for an endoscopy at Southern District Health Board?
Honourable Tony Ryle.
Mr Speaker, I would have to check whether that data is correct or not, but it would depend whether or not the patient had been. It would depend whether the patient had been booked in advance for a regular checkup, and that's the reason why they would be waiting a year, as we have a number of cases like that. But I'm determined that we actually have faster access for those sorts of services, and that's the reason why the government is closely monitoring those. We are ensuring, as part of our faster cancer treatment and better access to diagnostics, that we can improve those waiting times.
Supplementary question,
Supplementary
Mr. Speaker.
question.
Well, in light of that answer, is it acceptable for a patient who finds it difficult to eat because of reflux and nausea, vomits blood and has black tarry stools to wait 12 months for an endoscopy at Southern DHB?
Mr Speaker, certainly if they've got those symptoms, they need to go and talk to their GP and get prioritised to be going to see there. But there have been long-standing issues at Southern DHB. I highlighted those in a press release last week.
Point of order, Mr Speaker.
Point of order.
I asked the Minister whether it was acceptable for that condition.
And
yes.
the Minister was explaining that there have been issues at the hospital.
Yes, he was.
Would the Minister please continue his answer?
Mr Speaker, as I was saying to the member, there are issues at Southern DHB. I identified them in a press release last week, that what the government is working on. Those problems are long-standing. They include, for example, Southern DHB stopping providing surveillance colonoscopies to hundreds of patients in 2006-07.
Supplementary question, Honourable Annette King.
Is it acceptable for patients at Waikato DHB to wait on average 31 days for an urgent MRI, 128 days for a semi-urgent MRI and 174 days for a routine one, and what impact will those delays have on patients?
No, it's not acceptable.
Mr Speaker, I would have to check that information, because what I can tell the member, as the statement we said last week, 75% of patients waiting for an MRI are getting that MRI within 75% of patients are getting a CT scan within 6 weeks, and just over half of our patients are receiving an MRI within 6 weeks. Certainly those who are needing them urgently are getting them faster.
Supplementary question, the Honourable Annette King.
Is it acceptable for patients at Waikato District Health Board to wait on average 81 days for an urgent ultrasound and no routine ultrasounds being undertaken at all?
No, it's not acceptable.
Mr Speaker,
Honourable Tony Ryle.
I would have to check that information, because I simply don't believe that's correct. I would suspect that the member has received information as she had under Official Information Act, and she hasn't provided any coherence around what actual information she's asked the DHBs to provide.
Point of order, Mr Speaker.
Point of order, the
Point of order,
Annette
Mr
King.
Speaker. I seek leave to table from the Waikato District Health Board under the Official Information Act information exactly as I set it out including that not accepted, those that cannot even get a routine one, are returned to the referrer because they're unable to be completed within 6 months. That is the evidence he wanted, and I'll table it.
Order. Leave us sought to table that letter from the Waikato District Health Board. Is there any objection? There is none.
Supplementary
question, Honourable Annette.
Why did he re-announce his so-called new gold standard for diagnostic tests as new policy last week, when he'd already announced it last year? And does he think re-announcing policy actually gives patients better, sooner, more convenient health care?
Honourable Tony Ryle.
Mr Speaker, we were updating the public on the success that we're having in this, because when I became Minister of Health, the ministers couldn't actually tell people how long they were waiting for MRIs and CTs because Annette King wouldn't put any money into asking the question. And the reason they wouldn't ask the question was because a whole lot of people in Dunedin were being denied regular colonoscopies because that government didn't want to know. What we announced last week was part of what we updated and announced last week was that because of our new monitoring system, we can tell patients that 75% of New Zealanders are getting their CT within 6 weeks and 50% are getting MRIs within 6 weeks. Far better than under the Labor government.
I think that's quite a satisfactory, a long enough answer.
Speaker, I've got 2 documents I'd like to table.
Leave us sought to table 2 documents. A brief description, please.
Well, certainly. A letter from a patient from Southern DHB saying that he has to wait 12 months for an endoscopy and he has all the symptoms that I've already described. I have his permission to table it.
Yep, and the second?
And the second one is a letter from the Southern District Health Board, and the Minister wanted proof of this, saying that he has to wait for approximately 12 months for that endoscopy.
Leave us sought to table those 2 documents. Is there any objection?
So you got your proof now?
There appears to be none. They can be tabled. Question number 9, Colin King.
Thank you, Mr Speaker. My question is to the Associate